My name is Ashot Sarkisyan. I'm a professor of medicine from Armenia, from Yerevan, nephrologist working in Arapgir Medical Center. This is the referral center for kidney diseases. So only the one where kidney biopsies and renal transplantation is. So I am representing emerging center, and the supporting center is a university hospital of Bern, Inselspital. And my partner is Professor Bruno Vogt. He is head of one of the biggest, if not biggest, nephrology department in Switzerland, with all the necessary facilities to treat nephrology patients. I started our partnership program in 2018, and now we are at the level A. But with Sister Renal Center program, I am familiar since the very beginning, because we were the first or one of the first payers starting in the late 90s with the University Hospital of Antwerp, and we accomplished it in 2005, and thanks to this collaboration we could develop a living-related donor transplant program which is working very well now in Armenia. So this is a second turn for me to collaborate with University Hospital of Bern. As a history, I would like to tell that with Switzerland we have a very good tradition for decades to collaborate, because our center has been established with the help of pediatric hospital in Zurich. So we knew each other, me and my partner, for decades. So in 2018 we decided to start this Renal Sister Center program. Because from the first my turn I learned that this is very effective, and this has led to really results. I think we could establish a good transplant program in Armenia. So it was obvious that we will really have a chance to improve if we get to the second program. We focused mainly on 3 points. One is renal pathology, another is treatment of glomerular diseases, and the third is transplantation, improving the quality and increasing the number, making basis to start a deceased donor transplantation. Concerning renal pathology, we send the biopsies to Bern, but do light microscopy in Armenia, and then they proceed with investigation, and then having a number of biopsies, we make clinical pathological conferences, thus have a very good quality control, with this trying to improve our pathology service in Armenia. Concerning glomerular diseases, we have meetings, we have again consultations how to treat them, and concerning renal transplantation, we send our samples for immunological studying, donor-specific antibodies and so on, to Bern, having results and making transplantation safer and with a good outcome. With the COVID, we still stay with these all 3 options, because the traveling was limited and we stopped our visits. But meanwhile, we could make visits, 3 visits from supported center, 6 visits from our center to Bern, with access to all the facilities there, including nephrology, ICU units, dialysis facilities, and the transplant patients, and so on. Yeah, it's obvious that the quality really improved in those all three fields. Now we really improved our pathology facilities. The treatment is up to date, and also number of transplanted patients rising continuously, and that we have less and less complications. I would like to say that the program is, a second time I am convincing that the program is very efficient. And probably for some institutions it is only the way to have a expertise from outside, to have a consultations, to have a support and so forth. And also, last but not least, I would like to stress that these programs should be also based on a very good friendship and the personal communications. With Bruno Vogt, we are very good friends for decades, and it is very really to communicate, and he has a very wide vision, and he sees what his needs in countries with limited resources, always telling it is very easy to treat renal patients when you have all facilities. Try to do it when there are really limited. So I really should say that this program is very successful.